So let me invite us back together. As I was sort of doing this exercise on my own and thinking about what it was that she had written that helped me metaphorically recognize the link between the importance of joy and professional work the way I knew it, I found that her observation, first of all, that the gardener was looking at her work. So the gardener had found a spot to look at the work. So there was this need to get yourself into a spot so that you can look at it, not just sort of be in it. And the second thing that she observed is the importance of tending things properly in professional work as a bridge to a sense of joy in that work. The recognition that things flourish, but at their own internal clock, and the need to acknowledge that as we recognize the joy in professional work. Her observation that connections are made slowly. Sometimes they grow underground. Her observation about the effectiveness of the earthworm penetrating quietly without a trumpet. The creeper, the little damn worm that brings down the tree, and the need to fight persistently about the creepers. The irresponsible zucchini that spreads and overruns the garden and makes those way too big vegetables. The need to sort of pace and join the rhythm of gnawing in the dark and using the sun to make sugar, knowing when is the time to do what. The suggestion that weaving real connections was an important thing to do. Planning to live a life that you can endure, not one that is a sprint. One that involves love that's loving, tangling and interweaving, taking more in. And to some on the outside, they don't get it. It's a thicket. It's a bramble wilderness. But to those who are on the inside, it's interconnected rabbit runs and burrows and layers. The importance of living as if you liked yourself, and it may actually happen. Reach out, keep reaching out, keep bringing in that oscillation between what's going on inside me, the professional, and outside the world that is, in fact, the world I'm reaching out into. And find ways to bring that world in. And the recognition that after this long season of tending and growth, the harvest comes. It seems to me that what she evokes was a whole bunch of insight into health professional work and joy, if I was going to recognize it, if I was going to understand it, if I could find it, if I could see it. So having worked at a bridge between the notion of joy and professional work, now I'd like to dig even more deeply into this professional work stuff. Chapter 4. It seemed to me that joy in health professional work was in some way tied to the sense of vocation. And there were 5 people that had sort of summarized little ways of thinking about this notion of vocation or calling. Frederick Buechner, the theologian, said, connecting our deep gladness to the world's great need. Vocation is connecting our own deep gladness to the world's great need. Thomas Aquinas, when we discover something for which we are made, it not only leads to joy, but it expands us. Tagore, I slept and dreamt that life was joy. I awoke and saw that life was service. I acted, and behold, service was joy. Parker Palmer said, vocation is what you cannot not do. Sir Kenneth Robinson, the British educator, said that knowing what you're good at and passionate about and doing it That's what the aim of education ought to be, finding that. So, chapter 5. Chapter 5 is a complex chapter, and Bill Clinton had this wonderful way in his talk at the Democratic Convention where he said, now, we're going to unpack this. It's complex, so bear with me. So it's a Clinton invitation I'm giving now. I'm going to there's lots of stuff in here that I'm going to try to unpack. The first is, today's health professional work is grounded in the traditions of Samaritanism, science, and social accountability. In the mid-'70s, when I started my pediatric practice on the west side of the metro area at St. Louis, what then was St. Louis Park Medical Center, it was not uncommon for families at the end of the visit, in one way or another, to say thank you. 10 years later, just 10 years later, it was not uncommon in one way or another for the ending conversation to be around the question, why? Or, you made some recommendations. Help me understand why those are good recommendations. And I noticed this difference between thank you and why. And I wondered whether there was a shift going on that I really hadn't been alert to before. And I went into the literature and found this wonderful thing by Walsh McDermott, one of the sort of philosophically inclined leaders in academic medicine, who wrote about the importance of understanding the twin traditions that underpin health professional work, Samaritanism and science. And I thought, oh yeah, I get that. I wonder if there's a third that's starting, something like social accountability. It isn't that these things weren't being done in prior times, but that these traditions added themselves together. So I got curious about how people were responding with the addition of science to Samaritanism. And I went to the Wangenstein Library and started dusting around in those old books there to try to find out what was being said in the 1700s and the 1800s by the people who were leading at that time, the professors, the leaders of the profession. And they weren't a happy lot. I mean, this idea, the anatomist said, this idea that the femurs are straight is outrageous. The reality is the femurs are curved, just like the great apes that we've been dissecting, and it's only the tight britches that have made these femurs straight. Or the microbiologists who said, why should we believe in the notion of germs? Ethers are so much clearer. All hell broke loose when science was added to Samaritanism. And I thought to myself, geez, I wonder if that's going to happen with social accountability. Actually, I think it is happening. And it's some of the same leaders of the profession that are saying, well, over my dead body, don't you understand? It was interesting to me. But at any rate, I think today our health professional work is likely to be thought of as grounded in these three traditions: Samaritanism, science, and social accountability. Point number 2. Aristotle, many years ago, said there were 3 types of knowledge: episteme, techne, and phronesis. Episteme, knowledge of what something is. Techne, knowledge of how something has come to be. And phronesis, which had to do with making a good decision in the context you face. David Leach and I were talking about this once, and he had asked an Italian physician in New Jersey, an Italian-Greek physician in New Jersey, what phronesis meant, and he said, well, it's like my mother's cooking. She knows which rules to break and how far to break them. That's what phronesis is about. So Aristotle was saying there was the episteme, techne, and phronesis are the 3 different ways of knowing something. Well, that's the same kind of dilemma we're up against in health professional work today. We have to understand what is going on, how it actually comes about, and what's the right thing to do. What's the right decision for the person that we face or for the community that we're connected to? So that's the second subpoint. Third subpoint. We do all this in contexts today that are very challenging to change and improve. It used to be that health professional work could legitimately be thought of as soloist activity. No more. Health professional work is not soloist work. And because it isn't soloist work, we have this real challenge of trying to change it and try to improve it. And if we believe that professional formation and development, how we become professionals, is somehow unrelated to this stuff, think again. We're only going to make ourselves sadder and sadder. So this little triangle that you see there, the figure, if you look at the left-hand side of that, in the last 30 years, we've clearly gotten this idea that better outcomes for individuals and populations comes from better system performance. If we want better quality, safety, and value in the systems, we've got to work on the systems so that we can produce those outcomes. And, you know, we're pretty proud of ourselves. We got that. And the first invitations to people to play in that, people were curious. How are you going to figure out how to do that? And that'll be interesting. And by the third invitation, people weren't coming. This was more work. This was work that was being added to what was already a busy life. This was not a sustainable proposition. The idea that we could make care better by this way wasn't going to work over time. It might, in fact, lead to lots of exhortations by leaders, but it wouldn't sustainably improve health care. It was then that we began to realize that until we tied this effort for better outcomes and better system performance to the way we become professionals, the way we become nurses, the way we become doctors, and so that our very definition of competence and mastery and joy in work included making outcomes better and making systems safer and of better quality and value. It becomes part of our identity as professionals. Real joy in health professional work today and tomorrow is deeply connected to better outcomes in both individuals and populations, and better quality, safety, and value in the performance of the systems in which we work. Our job is not to protect our patients from the system. Our job is to own the systems in which we work so that they can, in fact, be better, be safer, be of better quality, be of better value. And this linked set of outcomes was not the work of just a few nerds or goons. This actually had to be the work of everyone. That's what makes transformative change possible. So my sense is that this triangle, this set of linked outcomes about today's healthcare work is fundamental if we want to create sustainably better healthcare. On Monday of this week, a book about this triangle was finally published. Linda will be happy to know that it actually did get published. She has a chapter in the book, and that's the reference. And so it's available. And there's a flyer that somebody has, and you can see it's a yellow flyer. All right, so that's point number 5. That was a long point and a big complicated stuff. So the next one is easier. Chapter number 6, Leaders Matter. This chapter is about the language of the commons in the places where we do our work. Good leaders develop and foster work environments that have a shared language of the commons, that people can be attracted to, irrespective of where they are in the organization, the front office or the front line. And they can take meaning and have sense about their work. That language of the commons is in short supply in healthcare today. We struggle for organizations that have that language of the commons, that in fact makes it possible at all levels within the organization to take meaning and joy out of the work. Next chapter. We use language every day in our work in the development of competence and mastery and joy in that work. And that sense of good professional work includes being able to make good promises. Because healthcare work is no longer soloist work, I would argue that we need to pay closer attention to the promise making that we do. There are very few courses in promise making in most schools of nursing or schools of medicine. And yet, we'll all become painfully aware of a broken promise when that is the reality. We have to make many different kinds of promises, actually. We make promises to ourselves about professional work. And what helps there is if we're actually clear about our personal values and the meaning of work for ourselves. We make promises to patients about the performance of the system. But if we don't know how the system performs, we can't make very good promises to patients about the system's performance. We actually have to know enough so that we can predict what will happen for the patient, and as it particularly might matter to the patients, not necessarily what we've been in the habit of measuring because it's easy to measure. Third type of promise is to patients about the professional's own role in the system. I have to know the way my performance contributes to the end results that are experienced by the patient. We make promises to our colleagues about our own work, and knowledge of the way our own work connects to the work of others makes it possible to make a good promise. And we make promises between professionals and organizations in today's healthcare world. And clarity about the values as they are and as they might be recognized in daily operations can actually help us with that kind of promise. Hannah Arendt, many years ago, said that in order for society to work, we have to make promises to each other. And if we fail to keep our promises, she said, we must be prepared to seek forgiveness. Making promises and forgiveness seeking is something we could do better at in health professional development and formation. So I'm going to try to use this last poem to begin to sort of work my way toward closure of this book. This is an old poem, 2,500 years old. It's probably my favorite, and one that I've been trying to understand for about 20 years. It's by Chuang-Tzu. The Wood Carver. King, the Master Carver made a bell stand of precious wood. When it was finished, all who saw it were astounded. They said it must be the work of spirits. The Prince of Lu said to the Master Carver, "What is your secret?" King replied, "I am only a workman. I have no secret. There is only this. When I began to think about the work you commanded, I guarded my spirit, did not expend it on trifles that were not to the point. I fasted in order to set my heart at rest. After 3 days fasting, I had forgotten gain and success. After 5 days fasting, I had forgotten praise or criticism. After 7 days, I had forgotten my body with all its limbs. By this time, all thought of your highness and of the court had faded away. All that might distract me from the work had vanished. I was collected in the single thought of the bell stand. Then I went to the forest to see the trees in their own natural state. When the right tree appeared before my eyes, the bell stand also appeared in it, clearly, beyond doubt. All I had to do was to put forth my hand and begin. If I had not met this particular tree, there would have been no bell stand at all. What happened? my own collected thought encountered the hidden potential in the wood. From this live encounter came the work which you ascribe to the spirits. So let me go back here. These words, I think, merit some really careful attention. The first stanza. The Master Carver made a bell stand of precious wood. When it was finished, all who saw it were astounded. Masterful work then and now invites the conclusion of astonishment. And it's so rare that we in fact think it must be the work of the spirits. Can't be any secular forces that are at work here. This was astounding. It must be the work of the spirits. The prince, who felt he could ask any damn question he pleased, not unlike a lot of princes in life, said to the Master Carver, "What's your secret?" And the Master Carver said, "I'm only a workman, I have no secret." What an outrageous lie. Because then he went on to say, "There is only this. When I began to think about the work you commanded, I guarded my spirit." Now, health professionals are not always at work at their own invitation. Health professionals are not always at work at their own invitation. The Master Carver said, "When I began to think about the work you commanded, I guarded my spirit." He moves from a command to mastery. He transformed a command into mastery. Well, that would never relate to what we have to, well, it might actually. Then he said, he fasted in order to set his heart at rest. So his pulse went up first. He was angry, got commanded to do this damn thing, and he wasn't going to. And the first thing he had to do was to get his pulse down, to put my heart at rest. After 3 days fasting, I'd forgotten gain and success. You know, being told, commanded to do this might advance my career. Well, maybe I need to get that out of my head. After 5 days, I'd forgotten the praise and criticism of your court, the cluckers, the professional cluckers. After 7 days, I'd forgotten my body and the limbs. This guy's a carver, for crying out loud. How's he going to, if he forgot his limbs, how's he going to carve? By this time, all thought of your highness. Now remember, I mean, this was not a time when highness meant nothing. I mean, this was risky. All thought of your highness and the court had faded away. All that might distract me from the work had vanished. So what do we need to do today to guard our spirits? What do we need to do to get where he got today? Then I went to the forest to see the trees in their own natural state. So to do masterful work, we need to engage the real world outside ourselves, the world as it is. This isn't just a matter of circumnavigating our navel one more time. This is actually engaging the world. When I went to the forest to see the trees in their own natural state, not a contrived state, not the one I bought and had shipped. It's actually in the natural state, the context. What happened? My own collected thought encountered the hidden potential in the wood. From this live encounter came the work. So we encounter hidden potential every day. And we encounter that hidden potential in the live encounters we have every day. So these invitations and reflections about the importance of joy in professional work begin, I think, with our willingness to risk the light. To see joy as partly beyond ourselves. To recognize joy in the midst of its neighbors. To connect joy and our sense of vocation or calling. Joy and the recognition of the linked realities that shape today's healthcare. Outcomes, system performance. And the role of good promises and joy and masterful work. That's what this short little book is about. Let me close with Wendell Berry's words. Why? why all the embarrassment about being happy? Sometimes I'm as happy as a sleeping dog, and for the same reasons and for others. We're going to hear just a little snippet of music, which may take us a little while to get to the right piece, but Beethoven actually said it very well. So would you play that little excerpt from the Ninth Symphony? I would submit that joy is important and it is related to what we do every day. Thank you.
It really jarred some of my thinking. I wonder if it jarred some of yours. And I want to open this up for not just questions. We want this to be, as we're going to do throughout the next couple of days, a conversation of the whole. And so we'd like to not have the question, answer, because there is no one right answer for topics such as this. So I would welcome people to, and I'm sure Paul would too, make comments, maybe a slight different take on what he had to say, to extend the conversation and maybe take some risks. So any, yes, please stand up, and there is the microphone here.
You got the microphone here?
Yeah, here's one. Thanks, Jenna. And please just say who you are. And
I'm Sheila Reges from the School of Dentistry, and this is fabulous. I was struck by the intersection of joy and leading change, and particularly in the Wood Carver. I believe there's a science to leading or managing change and helping people get through to the other side. And I was struck by how often I have seen people in my sphere go through the stages of the 1 day, 3 day, 5 day. And if you let them go through it, don't bargain, they get to that 5th day and they see the tree. And so that was my observation of the intersection of our work and leading change with these poems.
I think you're absolutely right about that. I mean, my sense is that there is a real benefit to having some engagement with people who make it their study, the study of complex systems, and enable this work today. I mean, the improvement of healthcare is a social process. It's not a soloist act. And so the idea of sort of getting rid of the garbage in your head like the Carver got is only part of the act. There's more to it, as you suggest. And I think that the more to it includes this recognition that we know something about changing complex systems today, and we ought to use it. But it is a bit of I think a conundrum if the folks that we're dealing with have this self-perception of victim. And so I want to go back to the master that lives inside of the health professional and invite that person to come. Yeah.
back here.
My name is Mary Goring, and I'm with the School of Nursing. And I had a question about, in one of the poems I can't remember, and you talked about finding your own ability or your endurance. So I would like to open up the question of what happens if you have found your endurance level is at a point where if you go beyond it, you become exhausted and are no longer effective as a worker.
Yeah.
And because our healthcare system is changing so rapidly, we might be pushed beyond our endurance, and how do we remain joyful when we have that in the environment?
Yeah, yeah. It's a really good observation. I mean, my sense is that I was having this conversation with my son-in-law this morning at 5 o'clock about by email with about a professional in his life who was running around like that animal with the clock around his head in Alice. I'm late, I'm late, I'm late, I'm late, and this constant stress of time pressure. And it reminded me of the Dreyfus model of the development of skill and expertise, and how as we move from novice to expert, and we particularly focus on the journey from competent to proficient, the person who's not at the proficient stage in today's world, the context has changed, is actually the one who is most conscious of the time pressures that in fact are facing that person. And see, the rules have changed around us. And so part of the challenge of becoming proficient in this different kind of world is in fact the kind of challenge that we face as health professionals. And my sense is that, at least I believe that that should be a good marker for us, that we've got to do some different ways of approaching the work. The work, in fact, just can't be done in shorter and shorter installments if the same thing is to be done. That won't happen. We have to redesign. The obligation to redesign healthcare is profound. And for people who experience the pressure of now having once been proficient, even expert, and now back to the proficient/competent stage in the Dreyfus model, that's not fun. That doesn't feel good. And so part of the challenge for us is to open this territory of redesign, the radical redesign of co-produced care, co-designed care. I mean, we're living beyond a professionalization of care. That was the people before us. We face a world where all of healthcare is co-produced with the patients and families and communities. And that's a reprofessionalization of our work. Who are we as professionals now, if that's the game? So I think we've got to open up very different conversations, because the reality is, as you say,
I'd like to just make an observation about that, because the Dreyfus model and then Benner within nursing, novice to expert and then beyond. But we had a situation once with a senior nursing student who was outstanding, and she was very strong. She won awards, and she had a long career ahead of her. And she started her first position, and she, within 6 months, almost left the profession. Now, not because the environment wasn't supportive. It was because she had the vision that through my career, I will increasingly become novice to competent. And when she started, not just went to competent, when she started as a novice nurse, she went back to novice.
yeah, absolutely.
And she'd been an outstanding student, but
Yeah,
she just sort of thought it was going to go like this.
Right.
Which to me then,
Right.
every time we change a role, every time we go back to school.
Exactly.
And so can you comment a little bit on
Exactly
sometimes the sort of the rigid application,
Yeah.
you know,
Yeah.
novice expert, and if I'm not competent by 29, then I'm doomed or something.
Yeah,
So
I think
can you-
that's I think that's really an important point. I mean, my sense is that where the Dreyfuses were correct, and where I think Pat Benner helps us understand this, is that there are many different things that go on in a professional's life, and many different beginnings in a professional's career. And to assume that you achieve a certain level of proficiency in the Dreyfus journey, and that you can then put that on as a pin to wear, because you are that wherever the hell you go, is a big mistake. And that can get you into all kinds of trouble, because you can assume you have a level of expertise that you have absolutely no basis for concluding. And in fact, part of the challenge is this understanding of repetitive beginnership that Peter Vail and his colleagues talk about, and what reflective beginnership is all about. And then you do go back to novice again, and paying attention to what it means to be a novice. And be a good novice, for crying out loud. Just because you were a novice before doesn't mean you got to be so damn dumb about it the second time. I mean, go after it in a different way. And I think that's really part of the challenge of recognizing that novice to expert stuff goes on all the time.
Yeah, I agree. Mike? Is there a microphone? No. Deb's got it. Okay, first, and then Mike. Okay.
I'll give it to you, Mike. I'm Deborah Olson, School of Public Health and School of Nursing. And I heard you talk about a new way for healthcare, co-development in the whole. At the same time, when I hear the Wood Carver story, it's still about I. It's still about the wood carver's limbs and the wood carver's sight. And I just got back from Thailand, and I'd like to suggest a different paradigm, a different way of looking at the wood carver. And it might get us, I hope, to a different level of service and a different level of sacrifice. And that is, as Dean Larock told us, if you look at the paper and look deep into the paper, you move beyond anatta. It's no longer about I. You look deep and you can see the tree. You look deeper and you can see the wood carver. And you look deeper and you see the wood carver's mother. And you look deeper still. So you leave the I and you move to the wholeness, all that brings it to us and brings the paper forward. So even though I'm not of Buddhist faith, I have an appreciation for us to move to the whole. We need to look deeper into the paper. Beyond the I as a nurse, I as a public health professional, I as a physician, in harmony with others,
Sure.
somehow we have to get deeper into the paper. So just another way of looking at
Great.
the wood carver.
Great, thanks.
Mike?
Hi, Paul Michael Petty. I'm a clinical nurse specialist in the hospital across the street. And I wanted to go back and reflect for a minute on your observation about your patients. You said when you started in your practice, they always said thank you, and now they always say why. And it's my perspective that healthcare is going to change in the ways that you're talking about. This might tag onto what you were saying earlier, in that we need not only partnership in terms of working with our patients, but they need to assume additional responsibility for health, because we are currently focused on health restoration instead of health maintenance. So my question for you is, do you think that when your patients started asking why instead of saying thank you, you went from being a provider to being a partner? And do you